Hi, everybody. Here we're again, a new episode of AI and mental health. Let's talk about it. As you can see in the screen, there's a Wysa icon here. We have Chaitali Sinha with us. She is the Chief Clinical R&D Officer at Wysa. She holds many positions at Wysa, and I had the privilege to do some work with them in the past. So I'm very happy to have you here, Chaitali. How are you?
Thank you so much, Eduardo. It's so nice to be back on a call with you again and hopefully get to talk about some exciting things about mental health and digital mental health and all the cool work that both you and I get to do in different places.
Thank you. Let me start by saying one thing. I have a background in academics. I've been doing research for many years, and there was always this big gap between what academics do and what the industry was doing. And I think something very admirable from Wysa is that they've done lots of things with academic settings, with health settings. And actually, I published one paper and another one that's probably it's under review right now with data that they share. I think that this is something that needs to happen, that industry needs to meet the academic field also to make the best of all of our fields, right? So thank you for being generous with those things.
Oh, thank you so much. I think we are definitely richer for having collaborators like you. And that's, I think, been something that's been really exciting for us across the journey, that there have been so many academic collaborators who've always been willing to work with us and spend time with us and really figure out how do we even study something that feels so novel in some ways and was novel at least 7 years ago.
Yeah. Speaking of which, why don't you explain to the audience what is Wysa?
Yes, absolutely. Let me start the story from the very beginning. So, we began Wysa in 2016. November 2016 is when Wysa launched. So, Wysa is an AI-led chatbot that delivers mental health interventions. And yeah, and I think there were two or three things that we were quite clear about right from the outset, that we wanted this to be something that really reduces barriers of access. And the key problem that we wanted to solve for was that if there's someone who is up at 3 a.m. in the night and is managing really distressing thoughts, who do they really talk to, right? And in most parts of the world, there is no answer to that. There's no good answer to that. Because even most helplines shut down by 11 p.m. midnight. So you usually have no resources. So what do you do at that point in time? And can there be any resource that's accessible? And from there, I think we started thinking even more deeply about access and the many axioms of that. So whether that's the economics of access or geography related access barriers, mobility related access barriers. There's so many reasons because of which people don't really get the mental health support that they need. And can Wysa be a response to that is something that we thought about really deeply. So when Wysa was initially launched by Joe Agarwal and Ramakant Vempati, who are the founders of Wysa, they threw it open for the world. So direct to consumer, we launched on Apple App Store and Google Play Store, and it was completely free. It still is completely free, the chatbot. So we have a couple of things that are paid on the app, and you can pay for it if you want, but there's no limitation. You can use Wysa as much as you like, and you don't need to pay for it. And that was a very conscious decision by the founders to one, make it free, make that as accessible as possible, and also not collect any data, which I think I feel really grateful for, that it allowed me as a clinician, as a psychologist, when I joined the team, to trust a product like that this is something that really is just for the purpose that it is intended, and not because it wants to collect a whole bunch of data on every single person coming into the app. So we made it completely anonymous. So even now, if you enter the app, you just need to put a nickname for yourself. You can call yourself Batman, and then you can start talking to Wysa. So there's nothing else that we require. So that again, I think has been really good and has helped a lot of other entities also trust us more deeply. So when we work with public health, when we work with regulators, they see that as a really large positive in terms of them allowing us then to access their populations or be able to work with entire countries, and not be worried about exploitation of data.
Mm.
So
Sorry, speaking about that think there was a review paper like a year ago, 2 years ago, which I think it showed Wysa as the most transparent and reliable in terms of how they handle data and transparency with the users. Am I correct?
Yeah, that was the Mozilla Foundation, I think, that you may be referring to. So they did a study, they did a very deep analysis actually of about 32 mental health apps, so the top 32 mental health apps in the world. And Wysa was the only one that was classified as best of, apart from the PTSD coach developed by the VA in the US. And so those were the only two, and primarily because our privacy policy in terms of service are actually how we behave and how we actually engage with both data and our users. Like that is really quite the hard policy, even internally. Like our compliance team really makes sure that we handle data properly, which is pretty amazing, I think, to learn that and understand how you can bring that maturity at an internal organization level too, just as much as, of course, putting it in policy.
Thank you. I would like to ask you about the things that you've done and the things that you're planning to do. So let's go first with the things that you've done. What are the main findings, the main highlights? I would say, okay, in these 6-7 years with Wysa, these are the things that we are the most proud of.
No, thanks so much for that question, Eduardo. I think two or three things, right, that I think have been especially both novel and meaningful for Wysa in terms of the research part of things, particularly. So one is that given that, we were one of the first chatbots out there that was trying to deliver mental health interventions, we really wanted to understand that why does this work? And again, I think when I was coming in as a clinician, most of my background pre-Wysa was very non-digital. I was sitting on the ground and talking to clients in a conflict zone or in a rural area. And so from that context, coming to a chatbot that is now talking to a person and delivering a mental health intervention, I was curious to understand, why does this work? So I think we did some really interesting work around trying to understand the therapeutic alliance that is built between a user and the chatbot. How does a person experience that? What does that look like? We're continuing to do some really interesting work around that. We're now doing more longitudinal work to understand therapeutic alliance. Apart from that, some of the other more well-known aspects of the relationship that people form with digital health apps. So what does engagement look like, retention look like? And because that's usually one of the main concerns with anything digital, that you may have created something meaningful, but will people's attention stay long enough that they can actually get benefit out of this? So those were some of the things that we did some really interesting work around. And the other thing is, of course, I think being able to work with very different kinds of patient cohorts. So we've done quite a bit of work with individuals managing chronic pain. We've done quite a bit of work with individuals managing different kinds of chronic conditions like arthritis and diabetes. And apart from that, also very large global public health studies. I think that's probably the last and third point I'm going to mention about things I'm excited about that we've done. Especially during COVID-19, we were quite interested in finding out that given that we exist right now in 95 plus countries, how many individuals were actually being able to receive the needed support from Wysa when they were going through the psychosocial distress that COVID-19 caused for all of us. So what does that look like if you look at that across a particular geography? So if you look at just the entire country of Singapore, the entire country of the UK, right? Like, did negative emotional utterances increase every time that there was a large wave when the number of cases were rising? Was that something that was leading to psychosocial distress? Were their scores in terms of PHQ-9 and GAD-7 actually reducing when they were using Wysa? Was it actually being able to help with the mental health symptomatology that they were experiencing at that point in time? So those kinds of research questions, I think, have been really fascinating to explore and understand better, that where can this really help when you dive in a little bit deeper, when you go past that first layer, So who is it being able to support, and what does that person look like? Where is that person sitting? What is the location in which Wysa is used? I think that was another fascinating question that one of our advisors had asked at one point, that maybe we should look at all our reviews to see what are the spatial locations in which each chatbot is used, right? That how do they create that sense of privacy around them? even though they're talking on text and on a phone. So those I think are really fascinating questions, which also respond to larger and slightly more abstract questions, perhaps, that when you think of a digital relational agent or a digital therapeutic, where does it really sit in a person's life? And what does it help with? So apart from those broad outcomes of efficacy and engagement, and is this helping, those are things we've responded to quite a bit across a whole bunch of clinical trials and RCTs. But these slightly more abstract questions, where the impact of that is not just limited to just Wysa or just mental health, but really everything that's happening in the world right now, I think that's pretty fascinating too.
Thank you. Thank you. I want to kind of summarize a little bit. You mentioned and make a few comments. You mentioned Therapeutic Alliance. We actually made a video on Therapeutic Alliance and conversational agents where we cited your studies. You also mentioned about helping different cohorts of patients. You mentioned chronic pain. I will ask you about that one in a minute, but the studies that we published with you were about individuals with autism spectrum disorder. So it's very interesting that you're giving help to people across different problems. You talk about engagement and you talk about large public studies, and you mentioned 95 countries. This is a beautiful thing of these resources, that we can help people all around the world. So this is great. Thank you. And now I would like to ask you about the chronic pain studies, because I think that that's something that probably you are the only one that focus on this area, at least that I know. So can you tell me what have you done in this area?
Yeah, absolutely. And, again, I think just to share the story of it a little bit as well, this entire work began for us because an orthopedic surgeon from WashU in St. Louis just dropped us an email out of the blue in 2018, I think. And she wanted to find out that, she knew that the patients who were coming to her with concerns of and around pain, she could support the biological element of it. She could give them medication, but when it came to psychosocial support, there was nothing. It was just an empty space. So is there something that we could do, that we could give to chronic pain patients and maybe put in a study first to see if it even works? That's how the very first study began. And a quick snippet that you have about the paper there, Eduardo, that is from that very first publication that we did with her. Her name is Dr. Abby Cheng. And that's really how our entire body of work around chronic pain began. So we did that study where we were looking at the feasibility of something like this. After that, we did another study where we were doing a comparative, that what does this look like compared to usual care? What does this look like compared to an in-person psychologist? How much is it being able to help? And we had some secondary outcomes, which, we weren't even sure, I think, if we'll see any movement on that early on. So we looked at, could Wysa help with reducing symptoms of anxiety and depression, but also reducing symptoms of pain interference and improving physical function? So now being able to see improvement across all four in different areas, I think that was really fascinating for us when we looked at the between group and within group differences in these different studies. And then after that, I think our work became even more interesting, right? So one, we started approaching the NIH for larger studies. We did a couple of studies where we were looking at how could we make this more accessible for older age cohorts. So people who are above the age of 60 or 65 plus, what are they saying about an app like this? Is it actually usable? What are their reviews? So we did some qualitative studies funded by an RO3 grant there. We did some stakeholder interviews, that what do orthopedic surgeons, nurses, all the stakeholders within a hospital environment really feel about delivering this? Can they deliver it? What are the feasibility constraints there? So now I think really trying to concretize this, that if you actually deliver this, what would the journey look like? And we very recently got awarded an NIH RO1 now for the same body of work. And that RO1 is going to look at the personalization of the chronic pain work that we've done, that as opposed to assuming that there is one digital health intervention that can work for all individuals with chronic pain, can we really personalize it based on what a person requires and what they are sharing with us about those requirements as the journey is ongoing within Wysa? So that's something that we're studying in a just-in-time adaptive intervention study that is a 4-year long, 4-year long study that has just begun. So, I think it's been a really interesting journey there.
That is fascinating, especially given how chronic pain and all the cost associated to chronic pain, right? I would like to highlight one thing about the study that you mentioned. One of the studies that you mentioned, you compared 3 conditions. One was the physician with Wysa, the other one was the physician alone, and the other one, the physician and in-person counseling, right? And what you saw was for depression, pain interference, and physical functioning, the physician plus Wysa was better than the physician alone. So that means you're adding value to this, right? To these particular patients. And then there were almost no differences between the physician and Wysa and the physician and in-person counseling. So this means that, hey, when there's no people that can provide in-person counseling, this is an absolutely valid option. And why not combining both things and giving a better service for the clients? So I think this alone for me is one of the things that I like the most from all the things that I've been reading about Wysa. So congratulations about these studies.
Thank you so much, Eduardo. And no, I think it really helped us also understand that where it can work, who it helps, and just, I think, clarify that image further. Another interesting thing that happened around that was that NPR then did an article around some of our chronic pain patients. And they actually managed to speak to some of the patients whom we'd never spoken to, because they were just part of the study. And so they did an interview with one of those patients, and what she shared about why she started using it and why she stuck to using it, I think really clarified those thoughts for me. So she talked a little bit about both how it felt really strange when her orthopedic surgeon for the first time said, you should talk to this chatbot. And she laughs in the interview when she was sharing that. And she was like, okay, I didn't know what to make of that. And then she started talking to it, and she said that it really helped because when I was awake at 3 a.m. and my entire body was hurting and no one else in the house was awake, that's when this chatbot was always there with me. And so that really helped. And it helped me calm down my anxiety just before I was going for appointments. And I didn't know if my pain would get better or not. So I think some of those statements that she made about where it was really helping, again, I think really helped me understand what kind of an impact something like this could make.
These type of testimonials for me are probably the things that got me very excited about this field. I was doing a lot of research on different type of technologies. And when I started reading what users were saying about these conversational agents, hey, this is something completely different from all what we have done, right? So, and we're all hearing these type of users comments from the users. So it's not just me and you, right? Now, I want to ask about something that also happened in Wysa's trajectory. That is, you end up doing an agreement with the National Health Service in the UK. I'm curious about how does that work? What are they doing?
Yeah. And thank you so much for asking about that. So we've been doing some or the other work with the NHS for a while, for a long time. And that journey also began somewhat serendipitously. A nurse who was working in one of the children and young adult services discovered Wysa through one of our direct-to-consumer channels. She just downloaded it, realized that it was really working for the adolescents that she was serving. And then she reached out to the team and said that, this is something that's actually helping, that's actually working for everyone, and you should do more of this. And that's kind of how we started talking to quite a few NHS professionals and the team there. And this was, again, quite early on. So this was 2017, probably a year into our launch. And since then, I think we were developing certain things. One, we did a number of studies with the NIHR, which is the health authority, health research body there, worked with the MHRA to become a class 1 device. And now we're deployed across about, I think, over 40 trusts in the UK with the NHS in multiple ways. So we're solving for the waitlist related and treatment gap related issues on multiple levels. One, we've become the main mechanism of triage across the service. So there's usually a mandated assessment that needs to be completed by every patient before they can begin treatment, mental health treatment within the NHS. So doing that in a way that patients don't just drop off, but they actually complete the assessment so that they can get treatment. That's a major problem they were trying to solve. We've become one of the answers to that, and we're doing the entire triage. We've become the waitlist treatment. So while they are on waitlist and waiting for a therapist, they get access to Wysa. And that becomes the early intervention for mental health patients there, both in the adult services. And we have a slightly different version of Wysa for children and adolescents. And then the third part is that even while they're in treatment with the therapist, there is still adjunctive support that Wysa provides. So we both have created a mechanism for NHS therapists to be able to contact and communicate with their patients through a dashboard that we have for them. And we have a patient-facing app on which they get recommendations from their therapist about what they should use, how they can complete their homework, their to-dos and summaries for the week, apart from the larger gamut of tools that Wysa already has.
This idea of the adjunctive support, I like to think of the conversational agents now as digital co-therapists, right? We therapists, we work just with our words, right? Sometimes with some smartphone applications, right? But now we have someone that can also mimic some of the conversations that we have with our clients, right? But outside the session at 11 p.m., at 3 a.m. in the morning. And I like the idea of integrating them during the session also, so that the clients can also engage more with the utilization. We have done some experiments, and sometimes when playing with parents, when we do our interventions, we ask them, okay, they ask question, and before the bot answers, I'll tell you what I would say. And when they see that the answer of the bot is very similar to the one that I'd say, it's like, oh man, it's like I can have Eduardo 24/7, right? So I think there's a very big potential of considering this like a digital co-therapist. Chaitali, thank you so much. I want to ask you about what are the next steps? Because when you studied, this was mostly natural language processing, rule-based, and now these all large language models appeared, and there's like a big opportunity here. So where are you at there?
Yeah, thank you so much for asking that. And no, I think, the world has definitely changed in the last 18 months or so for all of us on that front. And it's a very exciting time in terms of also what we can provide to patients and users in terms of an experience. So the quality of conversations that LLMs are now enabling is amazing. And the challenge, though, from a digital health or healthcare perspective has always been that how can we make sure that we're still being clinically safe, and what can be ways to do that? So that's what we spent quite a bit of time, I think, honing our approach to that. We now feel like we've arrived at answers that we are comfortable with, that can pass audits and regulations, and we can still stay compliant to all the regulations that we spent so much time making sure that the app has. So from that perspective, we've recently launched Wysa Plus on our direct-to-consumer app, which is now which integrates LLMs at certain nodal points of Wysa, and that's now a part of our conversational quality. When it comes to our healthcare-oriented work, where we're directly working with patients, there we're giving an opt-in, we're giving a choice to the client that we're working with, that if this is something that they would want or not want, and also making sure that our own documentation is really exhaustive as to what is our answer to clinical safety, how are we ensuring that, and how do we really make sure that the LLM is something that will only enhance or augment the conversation and not create issues.
Wow. Well, Chaitali, thank you so much. Definitely, Wysa is at the forefront of artificial intelligence, conversational agents. And I admire your work, and I'm sure that what's going to happen in the next year is going to be also amazing. So thank you so much.
Thank you so much, Eduardo. Thank you for your time today.